on Treaty 6 territory, and we acknowledge the history, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant communities. Why are we here? Today marks the one-year anniversary of the World Health Organization declaring a worldwide pandemic. And as we go back to that day, when we all realized that our lives would never be the same, we're here to remember that. We're here to remember all those that have died as a result of this pandemic. We're here in recognition of all the essential workers who put their lives, their own health at risk by going to work every day. Essential workers, frontline staff who lost their lives. We're here to remind those under the dome and in this building of the importance of our public health care, the role that it has played in the past year, and to remind them that any attack on our public health care is an attack upon all of us. We're here to remind them that the lives of those that we have lost in this pandemic have a name. They have families, communities behind each one of these flowers represented here today. We're here to remind them that failures in public health policies have consequences. We're going to start with a moment of silence in recognition of each of those individuals that are actually mark the soul of this province. And it is for them that we're standing here today. So our first speaker today will be Wodak, who is the chairman of the Seniors Action and Liaison team. John?
There's a desperate need for improvement and accountability. Think about it. We inspect daycare centres, close them and break the rules. We shut down hospitals and animals in distress. When a small girl named Serenity died in care, we did not rest until we had a full explanation and justice delivered. So very simply, the question is, why is not society providing the same care to our aging friends and family members that we give to children and animals? What it's going to take is a little more backbone in the right places. Thank you.
Thank you, John. Our next presenter will be Janine Edwards with Alberta Arts Action. Nothing like the role that arts has in ensuring that our society is reflected and that is explained in a way that most people can understand. So, Janine Edwards.
Thank you, Sandra, for the roses. When I was a child, a man drove 20 miles on country road to bring my doctor father his ruined hand, his index finger severed. It was Sunday. We were eating pot roast. The dog was growling, wild because of the blood on the towel cradling the man's hand. My father gave the man a vial of penicillin and said, "Go and find your finger in the manure pile." It took, the man said, meaning it grew back into his hand, into his working life. This virus, this pandemic, has cut us off from the lives we're used to. All our befores, the afters, and the aftershocks ripple like an earthquake. How will we grow back into our lives? We've been cut off from our elders. We've put our caregivers at extreme risk, and all of our essential workers are deeply weary. We are afraid. We have been cut off from the sweet gatherings that mark our lives in rites of passage. We have been cut off from the comfort of shared grieving and shared mourning. As this virus metastasizes, carrying death like a thief in the night, stealing breath in a storm of fever. How will we grow back into our lives? Today, we see laid before us a ceremony of remembrance, a field of delicate artistry. 1,928 roses, each a symbol to commemorate each person who has died in our province from this virus, a virus that has affected every human being on this planet. This ceremony reminds us piercingly through the symbol of the rose of life's incredible beauty and also of its incredible fragility. How will we grow back into our lives? I call on each of us here today to speak for those whose voices have been severed from living, to speak for those severed from speaking by death. In their memory, let us call out those who privilege their rights above responsibility. In their memory, let us call out those who practice politics without compassion, without moral compass, those who see human beings as cogs in corporate machines, whose relentless pursuit of profit depends on exploitation and yields poverty and death. In their memory, let us call out those whose power comes from lies. In their memory, let us use our anger wisely as a force for repair, for resilience, for reinvention. This pandemic has split open the fault lines of ingrained, inherited systems of inequality that diminish and demean dignity and the safety of workers, of the elderly, of migrant workers, people of color, Indigenous peoples, systems that leave the most vulnerable of our communities at greater risk. This pandemic reminds us that some trillionaires make $150,000 a minute, while small and family businesses are shuttered and some bankrupt. How are we to grow back into our lives? When something affects us emotionally, we say we are touched. We say we are moved. And paradoxically, in a year where our movement has been so restricted, we yearn for the reassuring sweetness of touch, of holding hands, hugging, of hanging out, for the shared hush of theaters, of concert halls, for crowded dance floors, for maskless singing, for contact sport. But through all these restrictions, we say, been touched. We say, been moved by acts of kindness and bravery and compassion, by art and music and poetry and ideas ingeniously delivered through our computers. These roses also touch us. They move us with their cargo of beauty and of sorrow. Let us grow in that capacity to be touched. Let us grow in the movement to listen and respond to each other's world.
Thank you so much, Janine, for that, these wonderful words and the challenges out there. How are we to grow back into our lives without the change that's needed to ensure that flowers like this are no longer needed. We have definitely a call to action with that poem. So thank you so much for those kind words. Our next speaker is Heather Smith, the President of the United Nurses of Alberta.
I'm going to try doing this. I don't know if it helps. I just talk real loud. I know the sound system is not as good as we had hoped, but hopefully people can hear me. Yeah. So, good afternoon, everyone. 1 year ago, that is just 366 days ago, no one in Alberta imagined how our world would change and how quickly that change would occur. I'm proud to be here today with Friends of Medicare, Public Interest Alberta, and SALT, the Seniors Action Liaison team, to look back on the year we have been through and to prepare for what is ahead. This has been a year of heartbreak for many Albertans. Loved ones lost who could not be mourned, jobs lost, lives changed forever. This has been a year of profound impact for working people and their families. Certainly the pandemic has impacted healthcare workers, but there are thousands and thousands of other workers, or warriors, heroes or warriors, who have not been able to work from home. Workers who have kept food on our tables and gas in our vehicles. Workers who did essential jobs that have never seemed essential before COVID-19 because they were so ordinary, so much a part of our lives. Okay, a little late. For all workers, this has been a very, very difficult year. They have gone to work every day fearing for their own safety and the safety of those they love. In healthcare, we know 6 workers who have lost their lives. But there are many others who were left vulnerable and unprotected in their workplaces and paid the ultimate price with their lives. Many workers will struggle with the residual health effects after surviving COVID-19. Yes, vaccines will bring us hope, but the normal of pre-COVID is still many months away. Maybe it will never fully return. We look at these flowers today, and it is obvious that our seniors have paid a very high price. For decades, healthcare workers and healthcare advocates have called for change to seniors' care. Seniors deserve better. We got change, but not the kind we need. We all know how we got here, if we're honest. It was at best by neglect, but I suggest to you the way the present state of seniors' care came about was neither benign nor unavoidable. It was a predictable outcome of funding and policy decisions. Funding and policy decisions intended to benefit a few, not to help the many. Lack of transparency and accountability have made things worse everywhere in seniors' care. But the question I have today, the most important question, is this: will we in Alberta learn from what we have experienced over the last year? Real change has always been and will always be dependent on political will. We must remain vigilant. We must wear masks, wash our hands, physically distance from one another. And we must all take the vaccine as soon as it is made available to us. But we must also be vigilant for more changes to our healthcare system that will make things worse, not better. We must be vigilant for those in our society who would use the pandemic crisis to implement changes to our health care that will benefit the few and make things worse for the many. Today, we commemorate the one-year anniversary of COVID-19, and we mourn, especially for lives that need not have been lost. Tomorrow, we must demand changes that will preserve and improve our healthcare system, because seniors and all Albertans deserve better. Thank you.
Thank you, Heather. Here we cannot go back to normal, or what people consider normal, because normal was not working for our seniors. So before we go to our next speaker, I just want to take time to recognize a few MLAs that have joined us today. We have MLA David Shepherd, the health critic. We have the MLA from Edmonton Millwood, Christina Gray here. We have the MLA of Highlands Norwood, Janice Irwin here. The president of the Alberta Federation of Labour, Jill McGowan. So thank you so much, and thank you all for you coming out here today as well. And now I will leave you with Terry Price, who is the chairperson for Public Interest Alberta.
Thank you, Sandra, and thank you all for coming. I would first like to acknowledge that I'm of the settler community and a guest on Treaty 6 land. Who would have thought that a full year, 366 days, as Heather just said, that we'd be here on this National Day of Remembrance, one full year after the World Health Organization declared COVID-19 a pandemic. But we are here. We're wearing our masks. We're keeping ourselves safely apart from each other to honor the almost 2,000 Albertans who've been lost to this terrible disease. We are honoring them today with this beautiful visual display of handmade flowers, flowers made slowly and deliberately by Erin Alyward, the artist, while she thought about the many lives lost here and around the globe. I am Terry Price, and in addition to being the president of Public Interest Alberta, I also chair the Seniors Task Force for the same organization. As I look at the flowers and the hugely disproportionate number, the impact on the pandemic on seniors becomes exceedingly clear. Every white, silver, and gold rose in this display represents the death of an Albertan over the age of 60. The vast majority of these seniors died in one of the many congregate care facilities we all expected would be their final safe haven on the earth, and where we and they expected to receive physical and emotional care and social supports. Each of these individuals was loved by spouses, siblings, children, grandchildren, possibly great-grandchildren, and multiple other family members and friends. Unfortunately, most of them would have died alone, having been isolated from their families, friends, and others for days, weeks, and maybe months before they left us for a better place. The care workers in the facilities would have been completely overwhelmed in their efforts to protect these individuals. They never gave up. To protect them from infection and to comfort them when they did become infected. I believe our seniors deserve far better than this. Seniors organizations, advocates, journalists, researchers, and healthcare workers have been sounding alarms on conditions in facilities-based congregate care settings in this province for more than 3 decades. Successive governments commissioned reviews at public expense and then ignored the recommendations that were made. Academic researchers found alarming conditions for seniors and for the workers, but their findings were ignored. Investigative journalists exposed atrocities when they followed up on complaints or tips from concerned citizens and family members, and yet nothing changed. Surely, our seniors deserve better. Successive governments offloaded more and more of the care for seniors to privately owned and operated facilities, providing public funds but little scrutiny over how those funds were spent. To ensure their profits, The workers were seldom protected by unions, and most have had to work in several different facilities just to support their own families. Those corporate profits were then paid out to the shareholders' personal accounts when the money should have gone to the care of our loved ones. Don't our seniors deserve better? If we truly treasured our seniors, this never would have been allowed to happen. COVID laid bare the ageism in our communities. Our elders should be embraced as our knowledge keepers, as the sources of wisdom for future generations. Yet over the past 30 years, we have stoically witnessed the destruction of the healthcare system they fought so hard to build. Our seniors do deserve better. Let's tell Kenny and the government of this province that we do care about our seniors. We want higher standards of care governed by regulations that are enforced. We want public accountability for every care facility, accountability for their actions and for the spending. We want every last cent of public dollars to go to the care for our seniors, not to the shareholders. Our seniors deserve better, and it's up to us to make sure that that happens. Thank you.
Thank you so much, Terry. I think, again, that just joins the chorus of voices to the call for action that we currently need from this government. As Alberta's current government undertakes the task of consolidating the more than 15 pieces of current standards and existing legislation which pertain to Alberta's continuing care system, we want to let them know that we expect changes that will be focused on the values that we hold, that we have a shared responsibility as a society, simply just as what that sign says, that we expect quality care for our seniors now, that we will not take any more commodification of our seniors. People cannot be making profit from the care of our loved ones, and that needs to stop. And that's the direction that unfortunately we're seeing this government move towards. So this is a time where we all need to be on guard, because this is the time where they will be making significant changes in the ongoing care of our seniors. And if we don't stand up for them, we don't want to be in this place again where we have to look at those flowers and mourn for an unnecessary loss. So we please keep up to date on what it is that all the organizations that are present here today are doing when we're calling for action. I want to thank Public Interest Alberta, UNA, the AFL, the artists that made these flowers, Alberta Arts Action Group, I always forget her name, and SALT, who are here, and all the members of the Seniors Task Force that have joined our calls for change in this area. And I will now leave you with singers who will bring their voices to this commemoration today. thank you so much, and I welcome you to take a moment to reflect. And again, thank you for joining us. Please join, go to the website www.seniorsdeservebetter.ca, and you can add your name to the existing voices there that are looking for change. And thank you again for joining us today on this somber commemoration.
Thank you, Sandra.